surgeon puts on a green gown, straps a mask around the mouth and nose, and starts an operation in the theater without first making sure there's an adequate amount of blood. Blood gives life. It facilitates the smooth running of human body systems and helps transport food as well as support circulation, respiration, and other key body functions. Critically, blood is the vehicle that helps the brain coordinate the vital organs of the body. Despite the critical importance of blood to saving lives and healthcare generally, Ghana's blood banks are always nearly empty. Why? Tonight we visit the National Blood Bank at Kolebu, Ghana's leading hospital, to find out the situation there and discuss some positive outcomes to this critical challenge.
It's just gone past midnight in Medina, Accra, and the ambulance is finally here. For Amma Kosa, it could not have come at a more opportune moment. She has lost a lot of blood and needs to be taken to the hospital as quickly as possible. She's 8 months pregnant, but seems to have developed quite a severe complication. Luckily, Accra's traffic at this time of the night is not so hectic, and the ambulance races through with little effort. It gets to Kolebu Hospital in no time. Amma Kosa may need a blood transfusion, but the question is, will she be lucky enough to get one at Ghana's premier hospital? Blood in Kolebu is in short supply.
Many times, patients come in at a time that the blood bank is dry. There's no blood.
There is high demand for blood, always.
Worldwide, the commonest cause of maternal death is blood loss. So a mother, either before delivery, has a complication that is leading to bleeding, or soon after delivery, the womb is not able to contract well, and therefore there is increased blood loss. So there are measures to resuscitate this woman, but ultimately, what you need to replace blood is blood. So if this occurs at the situation that our national blood transfusion setup may not give us the adequate amounts we need, we may not be able to manufacture. We'll ring and run to other hospitals to see whether we're able to get blood. So the delay in resuscitating or replacing that blood loss can spell a maternal death.
The Accra Area Blood Center has a very wide capacity for holding blood. Presently, we are actually operating at subnormal levels, so we are having in stock about less than 100 units. People only give blood when they have to, not because they want to, but they have to, and it's because a relative or a friend has been transfused or needs to be transfused.
If all our husbands and relations could come and donate a pint or two, you reckon that we'll have so much there, because it is just the minority of the mothers that will develop a complication. But more often than not, we are told, oh, he's coming to donate, and it doesn't actually happen.
I think that this country should take voluntary blood donation serious.
The concept of voluntary blood donations hasn't really sunk into the fabric of the Ghanaian society. Everybody has to realize that it is not some group of people sitting somewhere who are supposed to stock the blood bank. Remember that blood is not produced in a factory. And when a human being needs to be transfused blood, it can only come from another human being. We don't know when emergencies will strike. We don't know when somebody will be so badly hurt that he needs a lot of blood at any one time. And if you come and assuming there's no blood in the blood bank and we are waiting for your family or friends to come and donate, that's crucial time lost, right? So it is a collective responsibility that everybody has to realize.
Amma Kosa has waited for hours for an operation, but the surgeons will not go ahead unless some blood is found, somewhere or somehow.
This girl is anemic and she needs blood quickly. Blood cannot be made. Donate blood.
Good evening. My name is Nortedua, and it's a pleasure to welcome you to yet another revealing discussion segment on the Maternal Health Channel. Today, we're tackling the issue of blood, its supply, its availability. Why are our blood banks bleeding? And what can we do to stop that? With me in the studio, I have Dr. Justina Ansah, who is the Director of the National Blood Transfusion Service. On my left, Justina, you're welcome.
Thanks.
On my right, I have Lovelives Gapson Della. He's a regional donor organizer with the Red Cross. He's got a lot of experience when it comes to mobilizing and encouraging people to donate blood, and he has a story to share, which highlights some of the challenges with the system. Right, let me start with you, Lovelives. I mean, you organize and mobilize people to, donate blood and save lives. Now you have a story to share with us.
A teacher from one of our schools in Adenta district called that the sister is admitted at the hospital she's in labor and needed blood to support the delivery process. Okay. Because the hospital they were on time to inform us, we were able to mobilize a group of donors to travel all the way from Accra to Aguna Sedro. It took them 2 days, though there was a little problem, but they were able to donate the blood to save the life of the mother.
So you move people from Adenta
Accra,
to Aguna Sedro
just for that.
To donate blood?
Yeah, donation.
Okay.
So we were successful with the donation, and it went through that we were able to save the mother's life and both the kids.
Right.
Yeah, that was the first scenario. And the second one was that a teacher also called from Dionste's Adenta in Adenta district that the father was transferred from Koforidua Hospital to Kolebu for surgery processes. They called that they need blood. So they transported the father from Koforidua to Accra.
Right.
Then we mobilized the youth quickly. We got to the hospital at 7 a.m. We have to join a long queue at 2 p.m. before we were able to donate the blood. So the next morning, they prepared the father of this colleague of mine for the theater, but sadly, we lost him.
Sadly, we lost a life. Call them blood mercenaries or blood volunteers. It's alarming that, calls have to be made for citizens to mobilize blood. Dr. Ansah, it sounds like the system must have a problem if people are having to place personal calls to mobilize blood. Let's talk a bit about the National Blood Transfusion Service. Maybe I'll start by asking your comments on what Lovely just
Thank you very much,
yeah.
Norte. Listening to what the two stories that he has narrated, you realize that in both cases, people had to be called to come in.
Right.
And this is what we call the family replacement system. And any country that runs a family replacement system for its blood supply it's not self-sustainable. Unlike the voluntary system, where people donate at intervals, you have the blood, you process the blood, take your time, process it, store it, and then when people need blood, the blood is available and the patient will then get the blood.
If we've been forced or shifted to this replacement system, is that not an indication that we have failed? If we go somewhere and the supply needed is not there and therefore we put in an ad hoc or knee-jerk system, then really that is essentially an admission of failure.
As we sit here, every hospital is doing its own thing apart from Accra, which has a blood center.
Really?
But what we are looking at eventually with a revised blood policy is looking at blood centers across country. At the moment, we're looking at one in Accra, Kumasi, and in Tamale, where education, recruitment, retention of donors, blood collection, testing of the blood processing, and then will be distributed to hospitals within the catchment area of each center. So it will not just be in Accra. And so what will happen is that it doesn't matter whether it's in Accra, Kumasi, or Tamale, the standard of blood or the blood that you provide for patients will virtually be the same.
The quality and safety.
The quality and safety will be the same. We have a lot of work to do in aligning people's mind about what
attitudes to blood donation
and knowledge and practices. We have challenges. I've seen that the biggest challenge is the fact that we do not have enough blood.
Right.
I mean, that is our raw material.
But that brings me back to the question I started the program with. Why are our blood banks bleeding? Is it just because people are not donating? Or can we also say you are not doing enough? I mean, he's been able to quickly mobilize people and they went somewhere. I didn't even ask him whether they were paid. Why can't the blood service do that for us?
Well, I mean, just like he said, he mobilized some people. That's good.
A few people.
But we need to mobilize. I mean, virtually everybody cannot donate. I mean, if you know that you should be between a certain age to be able to donate. But then everybody has a role to play. And so if we all play our role, then of course we would have enough blood. I mean, there are some challenges. We are limited.
Can the service not do what Lovelace is doing on a micro level? He is in contact with people. He knows where he can get them. He obviously had their numbers. And he pulled them together on a larger scale. Mass campaigns on a regular basis. Is that is that too much to ask for the National Blood Transfusion Service?
It is not for too much. I think we have that system in place.
Really?
But yes, we do. We do have the blood donor organization department.
But I was told a couple of weeks ago that we have 20 units at our premier hospital where we need 150.
Yeah.
That's alarming.
Yes.
So
yes. You see, what is happening now is that the demand for blood has gone up. I mean, there are more specialized hospitals coming up, specialized centers. Cardiothoracic center is one where it needs some surgeries need about 6-10 units of blood. So the demand is high. The first problem is that we do not have enough blood. People, the community will need to donate. That is one. When they need to donate, you also need basic equipment. You know, to go out. Sometimes the vehicles, you may have some in Accra, but I am talking about things nationally. In some of the places, they have to depend on vehicles that are going to be used by the hospital for other things. So sometimes, even though it's a mobile station, they have to wait. So you will need to have dedicated, probably vehicles for blood collection.
Vehicles and personnel.
And personnel.
The situation doesn't seem too clear. We need blood. We know blood is life, but people don't seem to be donating. Dr. Ansah says we don't have the blood, the raw material. Lovelace, let me come to you. You mobilize people, you talk to them, and they seem to respond to you, at least from the 2 stories you shared. Are people willing to donate blood?
I will say yes and I will say no. Some understand the necessity of giving blood.
Right.
Others, when you talk to them, you see that they don't have any knowledge, they don't have any education about giving why they should give blood at all.
Okay.
And some others, you see that they are religious or their religious background does not permit them to even associate themselves with blood donation.
Okay.
So you find out that there are a lot of factors.
Religion,
and
then the basic fundamental understanding that
this
is something I must do and I stand to benefit.
Yeah, understanding.
So education is key.
Education is key.
Right.
Because the message, as Mommy said, the message is not, we don't have any direct message to sell to the general public. So we are not actually getting their attention to that direction.
Okay. We've been doing this for years. Dr. Ansah, is it that we don't have a message or we don't know what to say?
I think, well, I mean, it boils down to education, but I think that we need to really package our message. And in many countries that have really done it, they have packaged their message and have really marketed it.
In which way? I mean, what do we need to do differently?
You have different target group. You have different people, different age groups, in different parts of a community. And the message that goes to them should be targeted. It should be different. And then secondly, there are a lot of half-truths around. So you need to really work on their minds to understand and then put in the right message. Right. So I think there's some message going out, but probably not enough, not packaged well, and it's not really targeted.
Who should be championing the fashioning and programming, formatting of this message? Is it the same? I think,
well, it's the blood service, but we need to work with specialists in the area. Right. That's what makes blood quite complex, because you need the social scientists, you need the marketing people, you need everybody to come together for people to realize that safe blood starts from everyone. So you have to get everybody on board. Of course, there's some people
What does
who
it take to get everybody on board? For the average person watching and listening to us, we're losing lives.
Yes.
So what are we waiting for before we get our act together? I've heard of interesting programs, Pledge 25, where young people are pledging from 17 to have donated a number of times by a certain age.
Yes.
What are we waiting for?
Those are some of the retention strategies we've put in. But I think that is not just enough. Like I said, Club 25 is looking at students in school and the pledge within the community, But we have the religious organizations, we have work groups, we have different people in the community. So we have to have the right message targeted to them. And again, I talked about coordination, because if we do not coordinate the message, then you have all kinds of messages going round, So it boils down to education.
Forgive my skepticism, but I mean, isn't this a matter of priority, urgency? Should we not hit the road now and say we need these messages and we need this response or this outcome?
We do.
It sounds like we are always saying we are not there yet. We should be doing it.
We do.
I don't want to do a program next year
and realize
say the same things. What are we waiting for? What is the National Blood Transfusion Service waiting for?
Implementation requires a lot of, going out, educating and all that.
I can't talk about blood without talking about the issue of fees or charges for blood. The average Ghanaian has in their mind that blood is sold. Can you tell us categorically, do we sell blood?
No, we don't sell blood. The blood has to be processed. You cannot use that. You collect blood into a blood bag. That blood bag is imported. After you've done that, you need to screen the blood for HIV, hepatitis B, hepatitis C, syphilis, all 4 markers. If any one of the marker is reactive, you cannot use that blood. The blood must be stored. The blood must be distributed. You have people going in to collect the blood. So you realize that there are various components that make up what we call the processing fee.
Which must be borne by the user.
Somebody must be borne. Somebody must bear it.
Does the user bear the full burden of
No, the user
processing?
does not. There's some of it that the blood system bears, and if it's voluntary donors, most of it is borne by the blood service. The voluntary donor does not pay any money. The blood service will bear the cost. A recipient, that is a patient who needs it, pays a processing fee.
So per unit
of
blood.
That's a processing fee.
Which I'm told comes to what? 30 Ghana cedis?
It's at the moment it varies from one place to the other. But again, that's one of the things that we're trying to regulate. If you have a voluntary system where the people are voluntary donors, so they are tested every time they come, you have a reliable pool. Unlike the family replacement where people sometimes are paying for others, they come and they tell you, oh, I'm a relative. But meanwhile, they are not relative. They might have collected money. So there's a hidden page system.
We hear shocking stories of people who say we've donated or we've replaced, and we are still told there's no blood.
Oh, definitely.
Would it be given to somebody else? Haven't I opened an account where I can be assured of blood?
Yes, but as we sit here now, somebody needs blood. As we sit here now, there's the emergencies. You need blood by the minute. So if the person comes to the bank, I mean, it's an emergency, okay? Nobody has donated towards that emergency because you don't know it's an emergency. The person comes and needs blood. What is in the bank will be given to the emergency.
It will not be put aside for that person.
No, so that is why I'm saying that we need to flood our voluntary donation, and you have the blood.
Lovely. Just quickly, I mean, the people you mobilize, they're regular people, right? Do you pay them anything? These people you move from Accra to Swedru, did you give them anything?
No, I won't say we pay them.
Right.
We only cater for their transportation and sometimes food, but nothing.
So that resource is coming from the Red Cross or from where?
Probably sometimes I take that responsibility.
Ways and means?
Yeah, I take that responsibility myself.
From your pocket?
Yeah, from my pocket.
Not really.
That responsibility from my pocket. And sometimes maybe the family...
This is frightening then, isn't it?
It is. It should not be.
So if Love Lives is broke, then this whole enterprise would have fallen flat on its face.
Sometimes you even get these volunteers paying for themselves to go.
Let me give you the opportunity to speak to the National Blood Transfusion Service. You are engaged in the foot soldier work, if I can call it that. What would you want them to change? She's talking about partnership. What would you want to say to the service? What can they do to help you save lives?
They should try to make the rigid system a little bit flexible. For everybody who wants to donate should just walk forward and say, I'm coming to donate.
Right.
Sometimes the way they just handle information about the people actually shut them off from taking that bold step.
Really?
Coming forward.
You have experiences where people have heard things about themselves?
I can't remember, it was in 2011. A guy we sent a colleague there to
donate.
Do the donation. So he said when they came back from the lab after testing the sample they collected from him, they came back and like about 5 people were in the room. They were already actually in the process. Then they just told him, you can't want to meet. The person said it in
you can't donate.
Yeah, you can't donate. Your blood is contaminated. The person put it straight with these words: your blood is contaminated. You can't donate. And he said this is a health professional.
I think that is unfortunate. Confidentiality is something that is very important, and of course we need to have. That's why we have to train our people in professionalism to make sure that people can trust us. Whatever information is kept. So I must apologize for that. It should not happen.
And he says you're rigid as well.
Yes, I think that when you say rigid, I'm not very sure about. There's an age limit. There's an age limit, and it's all based on science.
The queues, the bureaucracy, the procedures.
Yes, I think that if there's a lot of mobile sessions, you won't have a lot of people queued up in the static site.
Clearly, there's a lot of work to be done when it comes to blood, and even before the blood gets into your body. Wow, there's so much that needs to be done. I'll look forward to the day where Lovelace can walk straight to the transfusion service with a program and it will be taken and implemented and we could ultimately save lives. Dr. Ansah tells us there's so much they need and there's so much collaboration that is necessary. But I guess the key thing in there is that there's a partnership and a joint ownership or responsibility that we all need to take up in order to make sure that we have safe, quality blood available. The last point I'll say is ultimately we must put the leadership role at the doorsteps of the National Blood Transfusion Service. We should be able to assure every Ghanaian that when you get to a facility, there should be good, safe blood available. And we will keep on banging on your doors and asking the questions and looking for the resolution of these dilemmas, Dr. Ansah. So thank you for sharing with us. Thank you again, Lovelace. And great job you're doing. I can't imagine how you keep it up, but keep it up because you're saving lives. And thank you again, our viewers. Join us next time on the discussion segment. Good night.
I am afraid.
I've donated once.
It will make me impotent.
I don't have enough blood.
I'm too busy.
I don't care. Stop giving excuses. Start giving life.
Next week, we return to Kolebu to explore its relationship with other hospitals. Have we reduced our leading hospital to a mere dumping grounds for moribund cases from less equipped hospitals? Is there another meaning to what is referred to at Kolebu as dead on arrival? Thanks for watching, and good night.